I'm about to show you something that might shock you. Something you've had your entire life that can lower your blood pressure in under 2 minutes. Not medications, not supplements, your breath. And I'm going to walk you through 3 specific techniques right now, counting every second, so you can feel your blood pressure drop while watching this video. I'm Dr. Claire Whitmore, and after 2 decades as a cardiologist, I've watched patients avoid 3rd and 4th blood pressure medications using these techniques. I've seen systolic pressure drop 15 to 20 points in minutes, not hours, minutes. These techniques work because your breath directly controls your nervous system. Fast, shallow breathing triggers stress hormones and constricts blood vessels. Slow, deep breathing activates relaxation and dilates blood vessels. Blood pressure drops immediately. The pharmaceutical industry doesn't advertise this. There's no profit in teaching you to breathe. But the research is overwhelming. A study in Hypertension Journal showed slow breathing reduced systolic pressure by an average of 15 points. That's equivalent to adding another blood pressure medication. Except this is free, has no side effects, and you control it completely. By the end of this video, you'll have practiced all 3 techniques with me. You'll know exactly when to use each one, and you'll have a tool that works anywhere, anytime your pressure spikes. Let's start with technique number 1. Technique number 1 is 4-7-8 breathing. Developed by Dr. Andrew Weil, it's one of the most powerful relaxation techniques available. Breathe in through your nose for 4 counts. Hold for 7 counts. Exhale through your mouth for 8 counts. The extended exhale triggers your parasympathetic nervous system. This is your rest and digest system. It tells your blood vessels to dilate. Blood pressure drops. Let me tell you about James, 72 years old. His pressure would spike to 165/95 whenever he got stressed. Doctor kept increasing medications. Spikes still happened. I taught James 4-7-8 breathing. Within 2 minutes of using it, his pressure dropped to 140/85. Still elevated, but 25 points lower. He started using it 4 times daily. His baseline pressure improved. Less medication needed. All from breathing. Now we're doing this together. Get comfortable. Sit up straight but relaxed. One hand on your belly. You should feel it rise when you breathe in. If you have a blood pressure monitor, check your pressure now. Write it down. We'll recheck after. Ready? Empty your lungs. Breathe out through your mouth completely. Good. Close your mouth. Breathe in through your nose for 4 seconds. Ready? Breathe in. 1, 2, 3, 4. Now hold your breath. 1, 2, 3, 4, 5, 6, 7. Exhale slowly through your mouth. 1, 2, 3, 4, 5, 6, 7, 8. Excellent. That's 1 cycle. 3 more. Breathe in through your nose. 1, 2, 3, 4. Hold it. 1, 2, 3, 4, 5, 6, 7. Exhale through your mouth. 1, 2, 3, 4, 5, 6, 7, 8. Again, inhale. 1, 2, 3, 4. Hold. 1, 2, 3, 4, 5, 6, 7. Exhale. 1, 2, 3, 4, 5, 6, 7, 8. Last one. Breathe in. 1, 2, 3, 4. Hold. 1, 2, 3, 4, 5, 6, 7. Exhale slowly. 1, 2, 3, 4, 5, 6, 7, 8. Perfect. Notice how you feel. Heart rate slower, shoulders relaxed. If you checked your pressure before, check it now. Many people see 5 to 10 points drop after 4 cycles. Do this 4 times daily. Morning, midday, evening, before bed. 2 minutes each time. Trains your nervous system to stay calm. Technique number 2 is resonant breathing, even simpler. Breathe in for 5 seconds, out for 5 seconds. No holding, just smooth, steady breathing at 6 breaths per minute. This is the optimal rate for reducing blood pressure and balancing your autonomic nervous system. Let me tell you about Margaret, 76 years old, white coat syndrome. Every doctor visit, pressure spiked to 170/100 from anxiety. At home, normal. I taught her resonant breathing for the waiting room. 5 minutes before her appointment, her pressure at the doctor's office dropped to 135/82. Doctor couldn't believe it. This works because 6 breaths per minute creates cardiovascular resonance. Your heart rate variability synchronizes with breathing. Blood pressure drops, heart rate stabilizes, stress hormones decrease. You can do this anywhere: car, waiting room, watching TV. Nobody knows you're doing it. Let's practice. Hands on your belly, in for 5, out for 5. Smooth and steady. Don't force it. Natural breaths at slower pace. Ready? Breathe in. 1, 2, 3, 4, 5. Breathe out. 1, 2, 3, 4, 5. In. 1, 2, 3, 4, 5. Out. 1, 2, 3, 4, 5. In through your nose. 1, 2, 3, 4, 5. Out through your nose. 1, 2, 3, 4, 5. Continue. In. 1, 2, 3, 4, 5. Out. 1, 2, 3, 4, 5. In. 1, 2, 3, 4, 5. Out. 1, 2, 3, 4, 5. In. 1, 2, 3, 4, 5. Out. 1, 2, 3, 4, 5. One more. In. 1, 2, 3, 4, 5. Out. 1, 2, 3, 4, 5. Excellent. Feel that calm. Your pressure is dropping right now. For maximum benefit, practice 5 to 10 minutes twice daily, morning and evening. Set a phone timer, or use a breathing app. Consistency is key. The more you practice, the more your nervous system stays naturally calm. Technique number 3 is alternate nostril breathing, most powerful for emergencies, when pressure spikes and you need immediate relief. Called Nadi Shodhana in yoga, used for thousands of years. Modern research shows it reduces pressure faster than the first 2 techniques. Let me tell you about Robert, 68 years old. Nighttime pressure spikes, 180/105. He'd panic, making it worse. I taught him alternate nostril breathing. 3 minutes later, pressure at 150/90. Still elevated, but out of danger. Prevented multiple ER visits. Here's how it works. Right thumb closes right nostril. Breathe in through left nostril for 4 counts. Right ring finger closes left nostril. Release thumb, breathe out through right nostril for 4 counts. Breathe in through right. Close it. Open left. Breathe out through left. 1 complete cycle. This balances your nervous system, reduces stress hormones immediately, forces slow, deep breathing. Studies show 10 to 15-point drop in 5 minutes. Let's practice. Sit comfortably, spine straight. Raise right hand to your face. Thumb for right nostril, ring finger for left. Index and middle fingers rest on forehead or fold down. Ready? Close your right nostril with your thumb. Breathe in through your left nostril. 1, 2, 3, 4. Close your left nostril with your ring finger. Release your thumb. Breathe out through your right nostril. 1, 2, 3, 4. Left nostril still closed. Breathe in through your right. 1, 2, 3, 4. Close your right nostril with your thumb. Open your left. Breathe out through your left nostril. 1, 2, 3, 4. One complete cycle. 3 more. Close right nostril. In through left. 1, 2, 3, 4. Close left. Open right. Out through right. 1, 2, 3, 4. In through right. 1, 2, 3, 4. Close right. Open left. Out through left. 1, 2, 3, 4. Close right. In through left. 1, 2, 3, 4. Close left. Open right. Out through right. 1, 2, 3, 4. In through right. 1, 2, 3, 4. Close right. Open left. Out through left. 1, 2, 3, 4. Perfect. Notice the difference. Pressure should be noticeably lower. Heart rate steady. This is your emergency technique. Stress, spikes, panic. 5 to 10 minutes brings dramatic change. Now the protocol for using these strategically. Technique 1. 4-7-8 breathing, 4 times daily. Morning before getting up. Mid-morning. Late afternoon. Before sleep. 2 minutes each. 8 minutes total daily. Trains your nervous system. Technique 2. Resonant breathing. Longer sessions. 5 to 10 minutes twice daily. Morning and evening. Your maintenance practice. Keeps cardiovascular system balanced. Reduces baseline stress. Over weeks, lowers average pressure significantly. Technique 3. Alternate nostril. For emergencies. Pressure spikes. Stress. Anxiety. Racing heart. Your rescue technique. 5 minutes brings you back. Let me tell you about Susan. She combined all 3. 73 years old, pressure averaging 155/92 on 2 medications. Doctor wanted to add a third. Susan asked for 3 months to try breathing techniques. She did 4-7-8, 4 times daily. Resonant breathing 10 minutes every evening. Alternate nostril whenever stressed. 3 months later, average pressure 132/78. Same 2 medications. Dropped 23 points systolic from breathing alone. Doctor shocked. Agreed to hold off on third medication. Susan continues daily. Pressure controlled for 2 years now. These techniques work. Research is clear, but require consistency. Can't do them once and expect permanent results. Daily practice, like taking medication daily, except no side effects, no costs, no appointments. 10 to 15 minutes daily dedicated to proper breathing. The mechanism is simple but powerful. Slow, deep breathing activates parasympathetic nervous system, rest and digest system, dilates blood vessels, lowers heart rate, reduces cortisol and adrenaline, directly lowers pressure. With consistent practice, this becomes your baseline. Nervous system resets to calmer state. Here's your action plan. Step 1. Check pressure now. Write it down. Baseline. Step 2. Choose which technique to start. New to breathing exercises? Start with Technique 2, resonant breathing. Simplest. Need immediate relief? Use Technique 3, alternate nostril. Step 3. Practice 5 minutes right now. Set timer. Focus completely on breath. Step 4. Check pressure after 5 minutes. Compare to baseline. Most see 5 to 10 point drop immediately. Proof it works. Step 5. Commit to daily practice. Phone reminders. Morning and evening minimum. non-negotiable like brushing teeth. Step 6. Recheck average pressure weekly. Track progress. Most see improvements within 2 to 3 weeks. Step 7. Share with your doctor. Show pressure log. Show research. Ask about reducing medications as pressure improves. Never stop medications without supervision, but techniques often allow reduction over time. Safety notes. Safe for almost everyone. Feel dizzy or lightheaded? Slow down. Don't force it. Severe COPD or lung disease? Check with doctor first. These complement medical treatment. Don't replace it. Very high pressure still needs medications, but these reduce how many you need. Bottom line, your breath is your most powerful blood pressure tool. Free, always available, no side effects. Works. James dropped spikes 25 points. Margaret conquered white coat syndrome. Robert prevented ER visits. Susan avoided third medication. All with breathing techniques taking minutes to learn and practice. Don't let anyone tell you breathing exercises don't work. Hundreds of studies prove effectiveness. Most doctors don't mention them because they're not trained in breathing techniques. Medical school teaches medications and procedures, not breathing. You control this yourself. If this gave you practical tools you can use immediately, share it. Send to everyone with high blood pressure. Subscribe because my mission is actionable techniques improving health without more medications. Thank you for watching. Thank you for practicing with me. I'll see you in the next video where we continue teaching practical tools for controlling your health.